For someone who has low sperm count, morphology, and motility, the real key is to start with a massive intervention. We're talking about you should look into changing your lifestyle. You should identify which one of your lifestyles are contributing to the condition. For example, is it heat exposure from excessive sitting or your workplace or your environment? Or is it a lack of physical activity? Or is it dietary related? So you need to focus on what lifestyle changes can you make that will make a big difference. And if you can't make that lifestyle change, how can you improve the quality of that lifestyle? If you're sitting for long durations, then how can you get up more regularly to stretch? If you're sitting for long durations, then maybe you can use an ice pack to keep your testicles cool or point a fan towards your crotch. So those would mitigate the risk associated with that lifestyle to some degree. You also have to perform fertility-specific treatments. So we're talking about fertility-specific diet. You have to perform cooling treatments to the testicles. You have to do inversions. You have to exercise more regularly, take better care of yourself in general. It helps improve your well-being, and that leads to more resources being able to be allocated to sperm production and lower toxicity within the body so that there's less damage to motility and morphology. So a comprehensive approach is what works best. You should also be wearing some varicocele specific and fertility friendly underwear. That's really key. You should also take some kits if possible, because science shows that supplementation with specific herbs, vitamins, or minerals can help improve sperm quality. We're talking about specifically morphology, motility, concentration, and count. There's a whole lot of evidence for all of those. And then you also have to manage your environment. Of course, your psychosocial environment plays a big role in how well you manage yourself and how well you take care of yourself and the resources that you have. So it's actually a massive intervention that you have to run for yourself. And if you do that, if you really start doubling down on self-management, taking better care of yourself, your environment, your lifestyle, and start following some real treatments for fertility, and if you have varicocele, for varicocele as well, then you're going to start getting some really good results.